What diet is the best for people with multiple sclerosis? My guest today needs no introduction, the author of the Wahls protocol, Dr. Terry Wahls. Thank you for taking the time to do the interview.
Great. Thanks for having me.
No problem. And I know we're going to talk about your new study comparing a modified paleo diet with a ketogenic diet with olive oil. But before we get into the details on that, can you tell us a little bit about what you think we know scientifically about nutrition and MS so far?
That is a great question. So far, we don't have any studies that have been long enough that have really looked at changes on the MRI. So we can't say that diet changes the number of enhancing lesions or is a disease modifier. We can, however, say that people are much more interested in diet. There have been 14, maybe 15 dietary intervention studies. They're all small. Some has been as long as 6 months. So far, every diet study has shown that diet compared to the control, usual diet, is associated with reduced fatigue, improved quality of life. The kinds of studies that have been done are fasting studies, ketogenic diet studies, paleo diet studies, Mediterranean diet studies, low saturated fat diet studies. So, my advice generally to all of your audience is the standard American diet is always worse. Improving your diet, eating less processed food, eating less sugar, having more non-starchy vegetables is a common theme throughout all of those dietary interventions. Now, some will have low saturated fat, some the Mediterranean diet, the paleo diet actually have a lot of overlap between them. And then fasting strategies are helpful. So work on improving your diet. That will be a great step for whoever's following you.
Yeah, I mean, one thing I tell people with MS is that we know nutrition likely has something significant to do with the development of MS, just because the rate of MS varies so significantly throughout the world. For example, the risk of MS in Syracuse, New York, was once reported to be 1 in 222, but in Cuenca, Ecuador, it was only about 1 in 25,000. And it doesn't seem to be strongly genetic, as many Hispanic people of varying ethnicities can definitely get multiple sclerosis. So there's a lot of evidence it is due to lifestyle and other factors like sunlight exposure, vitamin D levels. So I know your last study that we talked about was the WAVE study comparing the swank diet with the paleo diet. And I have a card if you want to check out that video. But what inspired you to do this particular study?
Well, there's been a lot more interest in ketogenic diets, some very interesting, again, pilot data that has been showing a lower carb ketogenic diet improves mood, improves cognition, reduces fatigue, improves quality of life. And so we had the good fortune to have a donor who is very interested, again, both in the modified paleo and the ketogenic diet. She had conversations with me and said, "Hey, Terry, would you like to do a bigger, longer study?" And I said, "Sure, we'd love to do that." And so we had conversations over about a year about the possibility of doing this bigger study. And she and her family foundation signed on. And so we have the opportunity now to do a study that will last 2 years, comparing the ketogenic diet, the paleo diet to the person's usual diet. And we'll have MRIs at the baseline and at the end of 24 months. We'll be able to see what effect these three diets have on the number of enhancing lesions and brain volume over time.
Yeah, so I was going to ask you about that. Who's paying for this study? There's no money in broccoli, but it's good that there's
no money in broccoli.
There's some private donors out there who do care about these things. That's good.
Who care a whole lot about this.
So, can you tell us a little bit about the details of the diets? So the modified paleo diet and the ketogenic diet.
Okay, so the modified paleo diet is basically the same kind of diet that we studied in the WAVE study. Lots of non-starchy vegetables, berries, 6 to 12 ounces of meat. And then we have a phase where people remove nightshades and then reintroduce them so they can identify are nightshades a problem. The ketogenic diet, we stress, again, low carb, 50 grams of carbs, 100 grams of fat, and we prefer that people have olive oil as the primary fat, so it's more heart healthy, and you get all those great polyphenols that are part of the olive oil. And that people need to have a sufficient amount of protein, but not an excessive amount of protein so they can stay in ketosis. And then the third group, the control group, is people are going to follow their usual diet. We will give them a monthly bit of information on how to improve their diet. And so they will get a monthly information, but people can continue their usual diet, or hopefully they'll work to improve their diet at least somewhat, because we do so believe in food, and we believe in these radical things known as vegetables. And I laugh at my clinics at the VA. I would talk to my vets about increasing their vegetables, and I'd say 6 to 9 servings, and they go like, "Is that a week?" And I go, no, that's a day. But
yeah, I mean, I think people do see it as a dramatic difference, but hopefully even people in the control group will try to eat somewhat healthy overall if they're not trying to follow a specific diet. A few things stuck out to me. I was looking at the ClinicalTrials.gov website, which I'll also include in the links below. And by the way, for anyone interested in the study, I'll include the information in the survey you would need to get into the study. We are trying to recruit people because we want to learn this information, and it's a great way to contribute to our knowledge of MS and also hopefully to help yourself. But anyway, a few things stuck out to me. In your book, The Wahls Protocol, when you're talking about the Paleo Plus diet, you talk a lot about like coconut oil and how it's more stable at higher temperatures, better to cook at, doesn't generate trans fats. Why olive oil?
So olive oil is very heart friendly. Some folks who will adopt the coconut oil, which is rich in medium chain triglycerides, you get more ketones, coconut oil, coconut milk, totally delicious. But some folks will have elevated total cholesterol, elevated LDL cholesterol, elevated triglycerides if they go on coconut oil, MCT oil, or coconut milk. By stressing olive oil instead, we reduce the risk of elevated lipids. We also let the people in the ketogenic group have dairy. Having dairy and cheese will make the ketogenic diet easier to follow, easier to have snacks. They don't have to have the dairy, but if they want to have the dairy in the ketogenic arm, that will be permitted.
That's kind of another thing I noticed. I could say that the paleo diet group would be kind of like the Wahls paleo diet in your book. And then
it's certainly similar.
And then, the Wahls Paleo Plus was kind of similar to, the ketogenic diet, but then you're allowing dairy. You just did that to kind of make the diet easier.
Well, it's really not the Wahls Paleo Plus, the ketogenic arm. It's really an olive oil ketogenic diet, and it's more heart friendly because I wanted to get it through my IRB. And at 2 years on a ketogenic diet, I know a lot of folks are going to be very nervous about the cardiovascular risk factors, and so we modified the ketogenic diet to make it much more cardiac friendly.
So when I talked about the WAVE study and I posted on Twitter, some people said, well, Dr. Wahls, she's biased, she wants her diet to win. For this one, you've kind of advocated components of both diets. So maybe you're a little bit more immune to that criticism. Do you have any kind of hypothesis about what the result is going to be? I mean, obviously you think that no change in diet is going to be worse, but which of these two diets do you think is better?
I really don't know. I don't know. And I want to point out to all of your listeners that for the WAVE study and for this study, the conflict of interest management plan makes sure that 1, I don't have access to patients. 2, I don't have access to data. 3, the statistician who's analyzing the data is blinded or masked to diet assignment. You can't get any cleaner on that for understanding the data. And then we have the mass statistician who writes a report to the Conflict of Interest Committee to be sure that the conclusions that we have in our final report match their conclusions as well. When people create new molecules, new drug development, hopefully those institutions, those universities have conflict of interest management plans that also make sure those people who develop new drugs and new devices have unbiased analysis of their data as well.
Yeah, well, obviously everyone wants to show something when they're doing research. That's the point of research, but I think you guys are doing everything you can to make it as fair as possible, and we'll see what the results show.
And we'll see. And I mean, truly, the study team, we don't know which of the two intervention diets will be better. It could very easily be the ketogenic diet will be superior. They have great studies. And Bach, who's out in Germany, looked at the serum neurofilaments from his little pilot study he did of fasting, ketogenic, and usual diet. And he showed that though the clinical outcomes favored fasting, the serum neurofilament outcomes were markedly better for the ketogenic arm. So I thought, that was very interesting. I was very excited to see that they could see a difference in just 6 months, because we'll be measuring serum neurofilaments at baseline and at 24 months as well. So I'm very hopeful that we'll see changes in serum neurofilaments as well as whatever we see in those MRIs.
So, in your book, I remember you mentioned that in your clinical experience, if someone wasn't doing well, you would kind of advise they go on the Wahls Paleo Plus, which has this element of being ketogenic and also avoiding the allergens. What are your thoughts on that? Do you think that's the way to go to do everything possible if you are not doing well with MS?
So if you're not doing well with MS, we want to have the best diet that you and your family can sustain. We want to have stress reduction optimally addressed. And I want to be sure that you have exercise, that ideally you're working with a physical therapist, occupational therapist, so that you're moving, you're active. I'm sure you already do this, Brandon, that you're measuring their vitamin D and taking care of their vitamin D. And I would also encourage checking the homocysteine. If the homocysteine is elevated, adding some additional B vitamins. So I want people to optimize all of their diet and lifestyle as well as they can. Optimize their vitamin D. The other thing that I might do is check their hormones to be sure they don't have unrecognized thyroid insufficiency and unrecognized premature ovarian failure or androgen failure, because those things will certainly add to resistance, treatment resistance.
Now, obviously, like many people are trying to keep with some kind of diet, even if only for weight maintenance or preventing diabetes. And one of the challenges is just complying with the diet. I personally find it very difficult to eat the diet that I want to eat. How are you going to help people, actually stick with these diets in the study?
So we have our dietitians will meet and get people oriented onto the diet. Then we have monthly group calls with the dietitian for the two intervention arms. We have one group call for the paleo arm, a different group call for the ketogenic arm. For the usual diet arm, we send a monthly tips on how to improve their diet quality, including some cooking video resources and recipe resources to them as well. I think that monthly contact is incredibly helpful. In the intervention arm, the monthly contact with the dietitian and peers, we have found in our other studies to be incredibly helpful. That peer-to-peer conversation about what's working, how to make it fit into their life, in their family's life, has been very, very helpful.
Yeah, I definitely think that's a key element to it, because if you don't comply with a diet, it's not going to be effective, of course. Moving to like the outcomes of the study, you mentioned MRI scans, serum neurofilament. What else are you looking for in the study? What are you looking to show?
So the primary outcome is change in fatigue, quality of life. We have secondary outcomes with mood, anxiety, and depression. And then we have clinical outcomes in terms of the 6-minute walk test, 25-foot walk test, 9-hole pegboard, symbol-digit modality, so that's working memory, hand function. And we have low contrast vision, which is a really nice measure for optic neuritis.
Yeah, and I did see all that, and I think that's great. So we have a lot of different things to look at, and I'll definitely do a video at some point parsing through all the data when it's published. Go ahead.
And we're freezing blood. We're freezing a bunch of blood because, at the end, we'll write for more grants to investigate those blood biomarkers.
Just in case there's something else in the future that's discovered, a new biomarker, you have something to look at also.
Correct.
So who would qualify for the study? Like, who are you looking to recruit?
So we're looking for people age 18 up to age 70. You need to have relapsing-remitting multiple sclerosis. You have to be willing to be randomized so that you could have either a paleo diet, ketogenic diet, or usual diet, and we'll give you educational tips, once a month. You'll have to come to Iowa City at baseline 3 months and at 24 months. We need you to not have clinically significant heart disease, liver disease, kidney disease, serious psychiatric problems such as schizophrenia, and you need to be competent to give consent. You need to be able to walk 25 feet, either independently or with a unilateral assistance, so that would be a walking stick or a cane.
And so you don't have to live near Iowa City as long as you're willing to make the trip a few times, basically.
Correct.
So that's a big thing that will help you recruit. And is there anyone you think should not enter the study, that it would be unsafe to enter the study, that you'd be concerned about?
Well, I should say we've excluded people with coumadin because one of the diets has a lot of greens in it, and that would be a problem for coumadin. We've excluded people with insulin because as you make big dietary changes, your blood sugar may change, and we don't want to get anyone hypoglycemic. We've also excluded people with oxalate kidney stones because diets high in non-starchy vegetables will have more oxalates in them, and that may be a problem for people with a particular type of kidney stone, the oxalate kidney stone.
And I'm not sure if you mentioned this already. If someone is on disease-modifying therapy, it's perfectly fine to continue that therapy throughout the study.
Absolutely. So if you're on a DMT, we want you to stay on your DMT, of course. If you have just had a relapse or you have changed your DMT, we want you to wait 4 weeks before enrolling in the study. But if you've changed your DMT or you've had a relapse, you can still enroll. And we'll just schedule your first visit 4 weeks into the future.
Okay, perfect. Anything else you want us to know about nutrition in general in MS, or about the study in particular?
Well, nutrition in general, work on your diet, eating these radical things known as vegetables. They're really good for you. And be part of our study. For us to be able to answer the question, does diet matter? We need to do something called randomized controlled trials. So that means people come in, they get screened to get their baseline measurements. Then they go through a randomization procedure. So it's like flipping a coin. If you have a 1 out of 3 chances to get into each of the 3 arms, and 2 arms are intervention, 1 arm is the control group, so that at the end, when we compare how everyone did in the 3 groups, we can either say, you know what, they all did the same. And as a fact, the people in the usual diet group did in fact follow our suggestions. They improved their diet. And so all 3 groups improved their diet and they all did really well. Now, we will do something called a per protocol analysis that will tell us based on the foods that people were eating, were they adherent to the ketogenic diet? Were they adherent to the paleo diet? And was their diet more like the standard American diet? Was there for the usual diet arm, or was that person's diet more like one of the intervention arms? And so if they're in it helps us do the analysis so that we can compare with the control, because we need to have a comparison group to be able to have a conclusion at the end. as to whether either one of these intervention diets led to an improved outcome.
Yeah, I mean, scientifically, it makes sense. I mentioned the statistics on Syracuse and Cuenca, but someone could say, well, the people in Cuenca are different genetically and they're closer to the equator. And maybe it's the sunlight exposure that's driving the difference, or maybe it's diagnosis of multiple sclerosis. And this is sort of how we eliminate all potential confounders and see what is the effect of diet alone.
And it's certainly challenging when you do dietary intervention studies because when people have decided that, okay, I'm willing to do the work to be in a dietary intervention study, but of course I want to be on the intervention arm. I don't want to be in the control arm. And so that can be challenging to recruit. It's just so important that we have people that are willing to come do the work, be randomized, and are willing to accept that some folks will be in the intervention arm, some folks will be in the control arm. And because we're comparing two interventions, that means that people have a 2 out of 3 chances to be in the intervention arm.
Yeah, and even if you get randomized to the control group, you can still do everything on your own, that you, in your own best judgment of eating a healthy diet. And
correct. And we are giving people, as I said, monthly tips on how to improve their diet.
Now, one other thing, I know this isn't part of the study, but what are you going to do in terms of nutritional supplements, which I know you also recommend, but you're not specifically studying?
Yeah, we're doing 2 supplements, a phosphatidylcholine and a essential fatty acid, omega-3, omega-6 fatty acid. So people are taking 2 grams, again, in the intervention arm only, of phosphatidylcholine and 2 grams of omega-3, omega-6 fats.
Okay. And to go back to the issue of olive oil, is that like an actual change in philosophy, or did you kind of just do olive oil because you think this would sort of appease the IRB?
Well, I'd say both. My preference is if you do coconut oil, coconut milk, that's an easier ketogenic diet because you can get more ketones. And so you can have probably about 50 to 80 grams of carbs and still be in ketosis. If you do olive oil, now you'll need about 40 to 50 grams of carbs. It's a little harder to be in ketosis, but it's more heart healthy, and you get all those great polyphenols. So in my practice, if people decide to do the ketogenic diet, we talk about why olive oil may be preferable, but it's a little bit harder, and why coconut oil is a little easier. If you tolerate it and you like the flavor, a coconut oil ketogenic diet is really quite lovely. But certainly from a cardiovascular risk point, I think the olive oil diet is preferable.
And I presume you would still advise against cooking with olive oil. Is that right?
Well, so that's a controversial point. I prefer that people use their olive oil cold because then you get all of the great antioxidants, polyphenols. The hydroxytyrosol has not been damaged. So I'd rather you cook with broth, steam, bake, and then pour lots of olive oil afterwards. Certainly, if you cook with olive oil, then what I would prefer that you do is have a mixture of olive oil and broth, which will lower the temperature, so you don't have as much damage to the olive oil, although you'll still lose some of the hydroxytyrosol with that.
Okay. Well, so again, I think it's a great study. I'm glad you're doing it. I'm glad you were able to get the funding. And for anyone who's interested, I'll include all the resources in the notes below. Any final words for everyone, Dr. Wahls?
Come sign up. We're trying to get 156 people. We'll take people from all across the country. We would love to have you. We'll be recruiting probably for the next 18 months. And this will be one of the largest, longest dietary studies. Come be part of a groundbreaking study. We'd love to have you.
All right. Well, thank you again for the interview and have a great day.
Thank you.